Good morning. Thank you for being here with us today. I am Percio from Patient Experience, and we are here today to talk about Wyckoff's new robotic assisted surgery program. Here today with us are two of the program directors. So let's start our conversation this morning by introducing yourselves.
I am Dr. Ahmed, Chief of Surgery at Wyckoff Hospital.
Hi, Ralph Ruggiero. I'm the chair of OBGYN.
Okay. So thank you. So what does exactly robotic assisted surgery mean?
So traditionally we do surgery in an open method where we make a big cut and we put our hands in and do an operation, and then it has transitioned into a laparoscopic procedure where we put small holes and use instruments through the small incisions or trocars and do the operation. Now with the robotic surgery, we have a robot in between the surgeon and the patient. It does through those small incisions like laparoscopy, but it has more precision. And the physician will be sitting outside on the console away from the patient.
Great. So is the robot doing all the work? Is that what you're saying?
No, the robot is not doing the work. The robot is assisting the surgeon to do the work.
So what exactly is the Da Vinci robot? How does it work?
So what happens is that we insert the ports into the patient with minimally invasive laparoscopic surgery, and then we have a consult which is a little bit away from the patient, and what we do is we do the procedures the same as we would laparoscopically, only it lends us to be more precise, more accurate. We're able to do procedures that we normally can't do laparoscopically. So less people get open, the recovery time is quicker, and the pain is less.
And the instruments, unlike the laparoscopic instruments, they can move in different directions, just like a hand with the wrist and the elbow. So that's the main advantage of having robotic instruments in a patient.
Right, when you perform laparoscopy, there's only so many ways that you can bend your wrist, your elbow, your hands in order to reach a certain location, but with the robotics interface, the articulation is endless. So you could reach any point at any angle to perform the surgery more accurately, more quicker, and with less cause of injury.
Okay, so does that mean that it's only you and the robot inside the OR, or do you have anyone else from the surgical team there with you?
So all the people who usually help in the operating room are there. Anesthesia, we have the nurse circulating, and we have a nurse who's scrubbed in to pass the instruments. And we also have a first assist who stands next to the patient to change the instruments whenever the surgeon requires it to be changed.
So that's very interesting. Thank you. So tell us a little bit about the program itself. How did it start here at Wyckoff? How was that journey?
So actually, Dr. Ruggiero and myself, we have been talking about it for the last 3-4 years to get a robot at Wyckoff, specifically to do operations which traditionally we don't do with a laparoscope. There are certain surgeries, Ralph, you could elaborate on that, that benefit with a robot.
Right. So for instance, in my specialty, all cancer surgery is performed robotically. This way we can get the majority of the disease out, get the nodes out, and the patient will have a better survival rate. When it comes to pelvic reconstruction surgery, which is another specialty that we do here, it's more precise and the patient outcome is much better. And then there are a bunch of diagnoses that we have better results with. For instance, endometriosis, you're able to get every single implant out because that's a debilitating disease, and every single implant that you remove, the patient does better. And then there were many fibroids that were much too big to perform laparoscopically that now we can do robotically.
So were there any surgeries that we were unable to do before that now, because of the robotic assistance program, they're now a possibility here at Wyckoff?
Yes, so the GYN oncology is one. The other one is GYN uro-oncology, like prostate cancer is best done with the robot. So those cases have not been done at Wyckoff because we did not have the robot. And now that we have the robot, and we are hiring a urologist who specializes in uro-oncology, and we will be doing those procedures at Wyckoff.
So Dr. Ruggiero mentioned some of the benefits of using robotic assisted surgery in his area. So Dr. Ahmed, could you share some of those benefits in the surgeries that you perform?
So in addition to the cases which were not done before, like the uro-oncology and GYN oncology, even the regular laparoscopic cases can be done with the robot, and it gives major advantages to the physician and the patient. Number one, when the physician is looking through the console with the robotic camera, the vision is magnified about 10 times. So you see the anatomy much more clearly, and the risk of causing injuries to the patient is decreased tremendously. That's number one. Number two is the way the arms of the robot move inside the patient. The amount of pressure on the patient's muscles is less. So after surgery, the patients have less pain. So that is critical. Since we do it precisely and there is less pain, the length of stay in the hospital for all patients is less than with an open procedure or with a laparoscopic procedure.
Right. This is basically it's bloodless surgery. There's not much bleeding, and less of need for pain medications afterwards or opioids, and the return to work is much quicker. So if someone wants a procedure performed that's going to give them less pain afterwards and they want to resume their normal life quicker, this is the way to go. It is the standard of care this day and age.
And now that we've spoken about the benefits, what are the risks associated with this type of surgery that patients should consider?
So the risk will be, I would say, a physician who is not well trained on the robot. Even the company and the hospital, before the surgeon is ready to perform robotic surgery, they will have to go training, both on the online modules and in the lab, and be proctored for the first 3 to 5 cases to be able to do robotic surgeries on their own. So I will say the biggest issues with the robotic surgery will be an untrained surgeon, and the second thing will be if there is any complication like bleeding or injuries, then the physician is a little bit away from the patient. So the best way to do robotic surgery will be to have a well-trained robotic surgeon performing the cases.
Right. So credentialing is key. Dr. Ahmed and myself are very strict with our criteria, who's credentialed for robotics and who's not. And there's 2 ways to be credentialed. One way is that you are a robotically trained surgeon who comes to Wyckoff, and then we ask them to show us how many cases he's performed, and you should at least have 100 cases or so. And then there are surgeons who are never robotically trained that we send to the Intuitive to be trained, and after they went through a really rigorous training, we have them proctored. But overall, Dr. Ahmed and myself are there to ensure that the quality and safety is always maintained. But when it comes to complications, I think the right question is how does this help complications and injuries? So since this is much more precise, there's less of a chance of an injury that you would get with minimally invasive surgery like laparoscopy, or even with open surgery, because you see better, the field is clearer, and you're able to articulate your arms in more precisely.
Thank you very much, Dr. Ahmed, and thank you, Dr. Ruggiero, for sharing such important updates about that new program here at Wyckoff. Is there any other message that you would like to share with our community before we close today?
No, thank you. I think that if someone is considering surgery, they should at least come to either Dr. Ahmed or myself, and we will personally explain to them the benefits of having it performed here.
Thank you.
Thank you. All right.